one of the keys to improving your health in any way is going to be doubling down on your diet, and especially when it comes to rapid fat loss. Now, one of the best diets that you can follow that's sustainable, that is delicious, that's satiating, is going to be a good, healthy, low-carb diet. Now, what I categorize as a low-carb diet is a diet where you're consuming 100 grams of carbohydrates or less. Now, when we look at the priorities in this diet, when it comes to macros, it's going to be high fat, moderate protein, low carbs. It's going to be removing sugar, removing grains, removing processed foods, and focusing on good whole anti-inflammatory foods. We want to make sure that we're removing bad processed foods. We want to make sure that we're removing things like inflammatory oils, like soybean oil. Now, the low-carb diet, what we want to do is we want to have healthy carbs, okay? Think sweet potato, not white bread or white rice. Now, I like the low-carb diet because, as I mentioned, it's satiating and it's sustainable. It's anti-inflammatory. It gets results. It balances hormones. It does what it needs to do in order to help you improve your health. If you want to go the extra step, you can also do keto. But keto is a little bit more restrictive, a little bit tougher for people to follow, especially if you're trying to feed yourself and your family, because it's difficult to get the whole family on board to do that. And if you're trying to just make your own meals off to the side, it's a little bit complicated, whereas it's very easy to feed a whole family on a low-carb diet. So what I'll do is I'll put a link in the description to a cookbook that I wrote with my wife that focuses on how to eat with the low-carb diet. Now, if you're someone who actually wants to follow keto, like I said, that's kind of the next step, and that's okay. That's a really good health plan too, but it's more restrictive and it's not as sustainable, and it's very difficult to follow long-term for many people. And so I'll put a link to a training video I did on the ketogenic diet as well if you're looking for that little bit more. But I'm a big fan of the low carb. I've seen it work with the 15,000 plus patients I've worked with. I've always recommended that, and it really helps people transform their health every time. It helps them lose a lot of fat along the way.